Hello, everyone. It's Dr. Samantha Benjamin Allen, board certified in physical medicine and rehabilitation, here to talk to you today about living with sickle cell disease. Now, sickle cell disease is a genetic mutation in the hemoglobin, which are the cells that help, or the protein in our red blood cells that help to deliver oxygen to our tissues. So, when someone has sickle cell anemia, their red blood cells can be misshapen in a sickle type of shape, like a crescent moon, and these blood cells at times can clog arteries and stop blood flow to certain areas of the body where it's being affected at the time. And it can produce severe symptoms of pain. If you can imagine someone who has symptoms when they're having a heart attack from lack of blood flow to the area of the heart where they're experiencing this, an individual with sickle cell is having this severe type of pain in various parts of the body, usually the chest, abdomen, legs. And I don't know anyone who's had a heart attack dozens of times in their life, but episodes of sickle cell crises can happen multiple times a year and throughout the lifespan of someone who has sickle cell disease. Now, symptoms besides a crisis can include um, feeling weak or just not feeling well. So it's important that you know your symptoms. Everyone is different and symptoms can vary from individual to individual. So I can't really list specifics. And the best people to ask would be someone who's living with this disease. And it affects populations with ancestry from sub Saharan Africa, the Caribbean, South America, India, Saudi Arabia, Mediterranean countries like Turkey, Greece, and Italy, as well as, I feel like I'm forgetting a region, Central America. And treatment can include medications, proper support, and management of symptoms when crises occur, blood transfusions when needed, prevention and treatment of infections, prevention of stroke, stem cell transplant in some cases, but this comes with risk. So, of course, you would want to ask your provider what your options are if you are diagnosed with sickle cell. And medications are primarily prescribed by a hematologist, and it is recommended that anyone with sickle cell anemia have a hematologist that you have a good relationship with, who has been familiar with you for a long period of time and knows what protocols work for your specific situation. Because although protocols have been developed at various times in history, no one protocol works perfectly for each person. So it's very important that you log your symptoms and be self aware enough to know what you feel when something isn't going right or when you are deteriorating and get a crisis. It's important to know what you feel before that, what environmental factors might have played a role, like high stress, high heat, high altitude, etc. Now, besides recognizing your triggers, it's very important to be a self advocate, okay? Educate yourself about your body and your condition and your treatment options, and communicate effectively with healthcare providers regarding your needs. Self advocacy is so important. Know your needs and preferences. And there is stigma causing bias that we must disabuse in the healthcare system when it comes to the treatment of sickle cell anemia. So don't feel that you have to wait until you are in such severe pain to go to the emergency room if necessary for fear that no one's going to believe you or take you seriously. Please advocate for yourself. Now, the next thing is make sure you have support systems in place. So, family, network of friends, and healthcare professionals that you can always call on and who know you and can help to speak for you in a case when you might not be able to speak well for yourself. Join support groups. There are organizations that advocate for a sickle cell population and have resources that you can use to help you along your journey. Now, in terms of managing symptoms, if you do ever have a crisis, it's important to hydrate, hydrate, hydrate. And this is not just if you have a crisis. You want to hydrate always because it helps to prevent crises. And also, you want to exercise on a regular basis to get your blood circulation moving. And you want to do gentle exercises, low impact, and activities that maintain mobilization and circulation. Now, heat therapy can be helpful, relaxation techniques. Of course, I mentioned medications and a pain management plan. And providers, I also want to speak to you and say someone who has had sickle cell for many years tends to know what works for them and what doesn't. So please listen, listen to what they are saying to you, and remember to have compassion. We see people who come in with severe chest pain after, experiencing symptoms from a heart attack. Imagine that happening in different areas of your body multiple times a year. So this pain is severe and it should not be underestimated. And finally, I want to encourage you to have a nutritious diet rich in fruits, vegetables, lean proteins, and whole grains. Eating healthy and nurturing your body so that you can recover quickly if you do experience a crisis or get sick is very important because the risk of infection is higher when you have sickle cell disease, so you want to treat your body well. All right? Now, remember, sickle cell is a serious and complex disease, and it affects a disproportionate amount of people of color in the United States. Despite advancements in treatment of other genetic, hematological, or blood diseases, sickle cell anemia remains underfunded and under-researched. Organizations like Sickle Cell Disease Association of America and others advocate for the education in medical institutions about sickle cell disease and the impact of race on health outcomes and stigma in medical institutions to advance care and research in this population. The promotion of diversity, equity, inclusion is so important and vital to the medical workforce. So please keep this in mind wherever you are, whatever medical role you're serving in or healthcare organization. Diversity, equity, inclusion is super important to ensure that everyone is getting great care. Now, I'm going to leave some resources in the notes for support for anyone who's living with sickle cell or has a family member living with sickle cell. And I just want to give a shout out to Dr. Uche Blackstock, who is the author of Legacy and sheds a light on this disease in her book. It's an excellent read, and I recommend it for anyone who likes to read. It really is an important outlook on the state of healthcare and the importance of representation in the field. And I want to give a shout out to my cousin Nikki, who is a pillar of resilience and strength in living with this disease. You are admirable, my dear. Much love to everyone and have a great day. Bye-bye.